Yes.
My name is Furaha. I'm Furaha Abwe from Tanzania. I work with Urban Planning for Community Change, which is an NGO that I established after my PhD. And prior to that, I was teaching at the university, but I wanted to put into practice what I learned by helping the community where I'm living with. So I'm trying to, in this presentation, I'll be trying to share my perspective as long as my experience in Tanzania is concerned, where I'm working with the livable cities. I'm working on a livable cities project. Liz asked me to give a general overview of a pandemic in Africa. And today, when I looked at the WHO website, the update is that in Africa we have 769,000 cases as per today, and we have 5 most affected countries, which are South Africa, Egypt, Nigeria, Ghana, and Algeria. But we have also another surprising result, that we have countries which have COVID cases with 0 death. And these are Eritrea, Seychelles, and Uganda. We are also neighboring with Uganda, and this is really true that they don't have any death case reported so far. As other countries or other cities around the world, African cities took similar preventive measures to reduce the spread of the coronavirus. And among them include restricting urban public transport, practicing physical distancing, prohibiting public gathering, ordering curfews, encouraging people to stay at home, and lockdowns, among others. But as we know, these measures were good in terms of limiting the spread, but in one way or the other, they have jeopardized, they've affected negatively people's lives, livelihood, and public health. Unfortunately, in all the measures, public spaces, particularly the green spaces, were not considered as essential services. And in the green spaces, in the public spaces, I will talk about public market and green spaces. Public market in most of the cities, particularly in East Africa, were considered as essential service. But green spaces were not considered. So people were banned to attend or to visit green spaces, but they were allowed to go to the market to buy food items. This is an example in Uganda. These are the measures that the president has announced, where the local food markets were opened, but the green spaces were not allowed to visit. Now, there was a problem when people were confined at homes, in their homes, which most of people are not used to. Now, because of staying at home, people started getting mental health problems, and most of the psychologists have reported this. Now, my organization, Urban Planning for Community Change, in support with some partners, we have been conducting research on public spaces in general in the city of Arusha in East Africa. And we had done 2 separate studies between 2014 and 2019. We did one study on green spaces where we had to identify the quality and quantity of them, of the spaces. And another study was on identifying the quality and quantity of local public market in the city. And surprisingly, our study revealed that there is a huge spatial inequality of local public market in the city of Arusha. And this forced both vendors and buyers to travel, to spend more time on public transport to reach the nearest market. There are a lot of neighborhoods in the city which do not have a single local market. So people have to spend 20 to 30 minutes in a public transport to reach the nearest local market. On the side of green spaces, the city has got enough green spaces, but most of them are not developed. And I think most the town planning department had just assigned them, allocate space for that, but the municipality does not develop them. Most of them are not developed. We have only one which is developed by the city council, and we have other like 4 which are privately owned. On your left side, this is a map showing the green map, green dot showing green spaces in the city of Arusha. Then in a number of them, and on your right, this is a map showing local public markets in the city of Arusha. You can see most of them are like concentrated in the center. So people have to travel from far away to reach the closest market. I've selected a few pictures to show some of the green spaces. The top one, this is the Green Park, Arusha Green Park, which has been developed by the City Council. And then the other ones are also the lower on my left is also developed by the City Council. But the 2 on your right are just open spaces without any infrastructure, without any seating facilities on them. These pictures are showing green space which is privately owned. You can see the type of infrastructure that are there. But for children to get to enter this space, they have to pay at least $2 per day per entry. These are some pictures showing the local public market. And when the coronavirus case was first reported in Arusha, the government put washing facilities, hand washing facilities at every entrance of every local market in the city. And you had to wash your hand before entering the market. Now, based on our study and with the outbreak of the coronavirus, we are thinking that for future planning, we need to do the integration of town planning and public health principles. They have to merge. Historically, we know that town planning emerged or was born after the Industrial Revolution problems which arose centuries ago. Number 2, we are thinking that we need to address spatial inequality by establishing small neighborhood-based public markets so that people can be walking to the market instead of using public transport every time they want to buy their food items. Number 3, we need also to develop green spaces. As I said, our research shows that town planning department has allocated green spaces within the city, but they're just there, they are not developed. So my organization, in collaboration with some partners, we are planning to develop one green space as a model, and we will use this as a tool to advocate to not only to the government but to other stakeholders so that they can be developing green spaces, particularly for the low-income neighborhood. Lastly, my organization will be working hand in hand with the City Council to advocate for allocation of specific budget for public space management. This is what I have to share with you on the coronavirus, on the use of public spaces and the post-pandemic future. Thank you.